This is HR in Review, a podcast dedicated to HR thought leadership, actionable advice, and all the latest developments in human resource management.
Hi, and welcome back to another episode of HR in Review. I'm Amelia Brand, your host for today's episode, and today we're talking about what employers should be doing to ensure they're supporting their employees' mental health in the workplace. I'm joined by Alicia Nagar, Head of People, Wellbeing and Equity at Mental Health First Aid. She's an experienced HR professional and member of the CIPD, specialising in organisational development and equity and inclusion. She's an employee wellbeing and mental health specialist and has helped organisations to successfully embed support and shift culture as part of a comprehensive and impactful inclusion strategy. Hi Alicia, welcome. It's great to have you on the HR in Review podcast. How are you today?
Yes, I'm good. Thanks, Amelia. Thanks for having me.
Great. So firstly, would you like to tell our listeners a little bit about yourself and what it is you do?
Sure. So currently my role is Head of People, Wellbeing and Equity at Mental Health First Aid England. I've worked in HR for about 15 years now, predominantly in the higher education sector. But I also offer consultancy and training in wellbeing and mental health across the board. And I've worked with multiple sectors, including kind of the public, third, hospitality and fintech as well.
Great. So kind of jumping in to the topic of today then, what are some current trends you're seeing around mental health in the workplace at the moment?
Well, I think the really obvious one is around the cost of living. We know that lots of people are being affected by this, and we know from the media, etc., that lots more people than ever are using food banks. People are really struggling, and that's affecting individuals, and obviously that has a knock-on effect to the workplace. You know, most people, their main source of income is work, and obviously mental health. If you're not getting kind of your basic needs met, you're not going to be able to perform fully in the workplace either. And it's really a double-edged sword because businesses are also being impacted by this and in many cases can't afford a pay rise in line with inflation. So they really need to be creative with this. According to the Health and Safety Executive, work-related stress, anxiety and depression increased by 100,000 workers in 2022. And they said that 10% of suicides were directly linked to work as well.
Oh, interesting. Do you think COVID then has kind of impacted any changes in mental health trends you've seen? I mean, something that kind of immediately springs to my mind is perhaps, the new flexible hybrid way of working, and perhaps how that's had an impact on mental health.
Yeah, I mean, definitely. I think flexible working in particular is no longer a nice to have or a benefit. It's an expectation from a lot of people in the workplace. And well-being is at the forefront of people's minds. It's a big consideration when people are deciding whether to stay in a job or to seek a new one and whether that meets their needs. However, we do know that hybrid working and flexible working do need to be done well to be effective. And we know there are pros and cons. So it's a really good opportunity for some people to work flexibly, has a really positive impact on their work-life balance. And it can be really a lot more accessible for those with caring responsibilities or living with a disability. But on the flip side, people have increased feelings of isolation, perhaps if you're living alone, that kind of thing, and then you're working remotely. And it can obviously then have an exacerbated effect on mental illness as well. I think as well, people sometimes find it difficult to kind of draw the line between work and, home life when they're working from home as well. So there are kind of pros and cons. And the Centre for Mental Health estimates that 10 million more people may need mental health support as a result of the pandemic. So, we do know that it must have had an effect. But on a positive note, we shouldn't really forget what we did achieve over this period. So at the beginning of the pandemic, everyone went into, full kind of overdrive, and we did adapt super quickly. We had to change overnight. That's people and businesses. And we demonstrated that it really is possible. So we have a huge opportunity now to reimagine the way that we work and create much more inclusive environments for everybody.
Wow. I mean, that stat you gave just there of 10 million people needing mental health support. In that case, then, what can organisations do to help their staff exactly?
I mean, I think there's a whole lot that organisations can do to improve their approach to mental health and well-being, and there's lots of really good work being done out there already. What's really key for me is that change needs to start from the top, and everyone should have a well-being strategy that is, has buy-in from across the board. And I think part of that is really listening and engaging with your staff. So hearing about what they want, what's working, what isn't, and to get that continuous feedback and review all of your policies on an ongoing basis. And again, look for creative solutions for supporting staff. So, for example, in the financial wellbeing space, not everything has to cost a lot of money. We recently introduced healthcare cashback plans and financial platform, which gives wellbeing advice and information. And they were relatively low cost, in terms of against kind of a pay rise or anything like that. We also know that mental health training and awareness is proven to make a lasting difference because it really builds knowledge and capacity across the organisation and understanding so that everybody can really thrive at work. There are kind of traditional routes as well, like EAP services, which can be really helpful for people, and MHFA does as well. So we train people as mental health first aiders, and obviously we really endorse that and the effect it has on an organisation in a really positive way. We also know that mental health first aiders have a really positive impact on organisations. But again, the infrastructure needs to be around that service. We need to support the mental health first aiders as well as, them being able to support other members of staff. And with our new training, we do offer that ongoing support. But there also needs to be support coming from the organisation. There are other services out there that can help organisations to understand what their wellbeing and mental health needs are. For example, we offer a Start Well service, but there are other organisations that do that as well.
I guess kind of thinking about, what you said organisations can do to support their employees. How do you think that can apply to remote employees then? I mean, with so many more people working remotely, how can employers even check up on them?
I think that managers play a really critical role in that because obviously they're often the main contact and they kind of almost create the golden thread between an individual and the team and the organisation. So, given how much we value the managers to deliver these kind of, functions in an organisation, we really need to support them as well to be able to do it. Not all managers are equipped to have kind of wellbeing conversations, and it's really important that organisations support managers to do that. So that might look like training. There's also lots of kind of information and toolkits out there as part of our My Whole Self campaign at Mental Health First Aid England. Last month, we released a free toolkit on our website for managers. So anybody can download that completely free of charge. And I think it gives a really strong basis to have those kind of ongoing wellbeing conversations with members of their team to really understand how to support them going forward.
Why not subscribe to the premium version of HR in Review? You'll get ad-free content, early and extra episodes and more. Even better, although it's the premium edition, it's absolutely free. Sign up at hrreview.co.uk/podcast.
Great. I mean, so, we've talked about how and what organisations can offer. But for me, at least, the overarching question is then, why is it actually key that organisations offer support to their employees in the first place?
Well, I mean, I suppose the obvious answer is that it's kind of, just to be a nice employer. But, we also have a duty of care as an employer, and that includes protecting people's well-being. And we believe that productivity and well-being fuel one another. So by investing in mental health and well-being, both the business and its people can really thrive. So we want to create an environment where everyone is able to bring their whole self to work. And we're really keen on that at my current workplace because it's better for well-being and better for the business. And we know that if people feel included, they're much more likely to thrive in the workplace, and their mental well-being is likely to be supported. So we want people to feel safe and connected to work better together and, feel psychologically safe as well as physically safe, and to have their views heard and valued as well.
I mean, you just mentioned there the employer duty of care. And I guess it might be interesting to consider, I don't know what you think, some of the barriers to workplaces providing the support or even, fulfilling the employer duty of care.
So cost is probably the most obvious barrier for many organisations in providing support. And time. And we know from earlier conversation that financial pressures are on organisations as much as individuals. But the reality is that employers can't really afford not to invest. We know that research from Deloitte revealed that the cost to employers of poor mental health rose to £56 billion in 2021 from £45 billion in 2019. So investing in staff mental health is really, really key to a successful business. And we know that from every pound spent on staff wellbeing, employees can see a return of over £5 on average. I think there's also the challenge of kind of a lack of understanding and some people sticking to their old ways. So, for example, we've seen lots of positive changes kind of post-pandemic, but some people want to go back to the old ways, and that's just not realistic anymore. But if you're a HR professional really trying to make this case, there's so much data out there to demonstrate that investing in mental health and well-being is important.
I mean, yeah, it's really interesting to talk to you about how to provide support, what to support, and also, whose responsibility it is also to provide support. So, to wrap up our conversation then, we ask all of our guests on the HR in Review podcast 2 questions. So the first one, if you could pass on one crucial lesson you've learned in your career in 1 minute or less, what would be your top tip for HR professionals?
I think to be open to new ideas and to really listen to people and your people. What worked before may not work now, and what works now might not work in future. So just to really be adaptable and be able to take feedback on an ongoing basis. We've never seen that more so than during the pandemic, where everything moved so quickly and people were doing pulse surveys and checks with their teams all the time, and that gave us some really reliable and valid data to be able to quickly change in line with the changing landscape. So we really do need to keep up. And you'll have lots of data already in your organization. So that might be kind of, data drawn from kind of diversity information or from kind of sickness absences and things like that. You'll have your engagement surveys, exit interviews. If you have any ERGs or staff networks, they can be brilliant for hearing from. And you can also just create other opportunities to hear from your staff. So, run sessions where you're really focused on obtaining feedback as well.
Yeah, I mean, I especially, I like your point on adaptability there, especially in light of, the new working world and things like that. So the second question then, what is the single biggest change you think will happen in HR over the next 5 to 10 years?
Yeah, I mean, I feel like I'm sort of banging the same drum over and over again, but I think it's inevitable that we're headed for more uncertainty in the world of HR and kind of, in every aspect of society. So we do really need to remain agile and adaptable. As I said, we did demonstrate this when the pandemic hit and we changed overnight, but we can't afford to become complacent and think we've got it nailed and we know what we're doing and, everything's perfect, because actually everything's going to keep changing. The cost of living and financial pressures are not going anywhere for the foreseeable future. And we also know that people's expectations of the workplace have changed. So we really need to be able to kind of keep getting that feedback and keep being willing and able to change.
Great. That's super interesting. It's been really lovely having you on the podcast today, Alicia. Thank you.
Thanks, Amelia.
The HR in Review podcast is brought to you by hrreview.co.uk. hrreview.co.uk is a website dedicated to human resources and related professionals. News items are posted daily together with analysis looking in depth at topical HR issues. You can sign up for our range of specialist newsletters at hrreview.co.uk/sign-up and follow us on Twitter at hrreview or join us on LinkedIn and Facebook. Thank you for listening.